Hello, 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 everybody, and welcome to another fantastic and awesome episode of Let's Talk About So, continuing our discussion of sexual health this week, the topic for today is going to be testing and STI stigma. I have a big favor to ask right off the bat. I'd like everybody who's tuning in watching, thank you so much for joining us, but please share this with somebody. I'm getting lots of feedback about how much people are learning and all this stuff that they didn't know, and let's spread that around, spread the love. Sharing is caring, right? So please make sure you share this with somebody. Let people know that it's happening and help me get the word out, because people need help, people need knowledge, everybody wants to be sexy, and everybody wants to be safe. So, of course, Let's Talk About Shush, for the people who are joining us for the very first time, is a live call-in podcast where we talk about things like love, intimacy, and relationships, and basically any and every topic connected to that. We do have set topics for the day, but you can always feel free to call in with your questions, or if you have a comment or a story, or maybe you just want some advice, feel free to call in at any time. My name is Tila. I'm a sex educator, relationship expert, and published author. I've been doing sex ed for a long time. I love it. It is my passion. I want everyone to love sex ed as much as I do. I want everyone to feel as good about talking about it as I do, because it is awesome. It is not something we should be worried about or afraid to talk about. We should be open and honest with ourselves and our partners and our friends and everybody, because this knowledge is so important. It's a huge part of our lives for many of us. And, it's silly that we don't take the time to learn about it the way we learn about other skills, right? I think if we improved our relationship and communication skills the way we, worked on our game skills or our language skills or any of the other skills you develop in life, think about how amazing your intimacy and sex life would be. All right. So I love it when people comment. I love it when people chime in. I love it especially when people call in. But I do have some sort of ground rules just for commenters. If you want to comment, we want to build a really positive community here. We want people to feel comfortable asking questions. I know I've said this a million times already, but there is no such thing as a stupid question. People have all kinds of different levels of knowledge and experience, and people should never feel bad about asking something that they don't know. If they don't ask, they're never going to know. So let's encourage people to ask, and let's support people in getting their questions answered and feeling good about it, okay? So opening up the phone lines now if you want to call in at any point. Hello, Amanda. Thanks for saying hey. I always love that. If at any point people want to call in with their questions or comments or thoughts or anything, the number, of course, is 1-877-777-5589. And if you've been enjoying this podcast, like I said, please share it with someone. Get the word out. If you love it, other people are going to love it too, right? And if you're learning stuff, other people can learn stuff too. So share the love. All right, so I'm really pumped today. It's been a good day. I hope everybody else has had a great day too. And we're talking about something I love talking about, which is sexual health. Lots of people think that this is a super scary topic, but it's not. It's not scary. You should know this stuff. And you know what? It's good to know this stuff. It's good to have these conversations. So don't be afraid of it. It's great. It's not boring. It's not terrible. It's not awful. It's awesome. So you gotta love it, okay? So getting tested, that's where we're going to start today, and continuing our discussion about sexual health that we've been having all this week so far. Just as a recap, we did talk about sexually transmitted infections on Monday, and yesterday we talked about condoms and barriers, and I introduced you all to Mr. Jiggle Daddy, who I still have out because he's just really fun. So if you missed those episodes, please feel free to check them out on my website or on YouTube, or I think Twitch only keeps it for so long, but Facebook. And you can also download the episodes. If you just want to hear the audio, you can download the episodes from Podbean or Spotify. Links are all on my website, so check it out, exploresextalk.com. So getting tested. So getting tested is not only a smart thing to do to ensure that you're healthy and you're still healthy and staying safe and healthy, but it's also can be a strategy for safer sex. And, it's funny, I was thinking about it today, and I was like, we're talking about sexual health all this week, And I don't think I've actually mentioned like safer sex, which is funny because we talked about barriers and condoms yesterday, which is like totally a safer sex thing. So briefly, before I get into the rest of getting tested, talking about safer sex. So you may have heard this term. You also might have heard the term safe sex. Now, I've had the question, what is the difference between safe and safer sex? They're not really different. They're sort of talking about the same thing. It's just what you do to protect yourself and being informed and all that kind of stuff. The difference between safe and safer is the acknowledgement with safer sex that there's always going to be a degree of risk. You know, condoms break, birth control fails. You may not have had all the information. Like, you can only make it so safe. Do you know what I mean? Stuff happens. Stuff that happens that's completely out of our control. So that's sort of why a lot of people have sort of moved towards the idea of safer sex, just because it's acknowledging that you can never completely eliminate the risk unless you choose abstinence. But it's, I mean, that doesn't mean that that's a bad thing. It's just acknowledging that there are risks, you know what they are, you're prepared to deal with them, you're taking steps, you've chosen what you've decided works best for you. Therefore, you're engaging in safer sex methods. And that's sort of what we're talking about. So, getting tested is considered a strategy for a safer sex method. Depending on what kind of relationship you have, or what kind of relationships you have, because you may have more than one, or lifestyle or what have you, it may change some of your choices for how you wish to engage in safer sex. So if you're in a committed, monogamous relationship where you have been with the same person for a long time, maybe you and your partner feel that condoms aren't really something you want to go with. Maybe perhaps you're not concerned about pregnancy, or maybe pregnancy isn't a concern at all, if in the case of for some couples, for various reasons. So, you know, you may decide, well, you know what, we're not really exposing ourselves to lots of risks, so do we have to use barriers? That's a discussion that you need to have with your partner. And we're going to talk a little bit more about that tomorrow when we talk about fluid bonding. So I'm not going to get too much into that. But getting tested can be a good strategy for keeping yourself safe and minimizing risk. So how often you get tested should really depend on your lifestyle and the choices that you're making. Now, one of the questions I often get is, well, should I just get tested all the time? I should just go all the time. No, you should not go all the time. It is a waste of anxiety and time and resources. See, all the different STIs, they take a certain amount of time to show up. So say you have contact with someone who is positive for an STI and you're concerned, you're like, oh, you know, maybe found out after the fact, maybe they didn't know and they recently found out, they went and got tested and they're like, oh my God, I had this and I had no idea. And then they tell you, well, you should probably go get tested, right? But the thing is that depending on what the concern is, whether it's chlamydia, gonorrhea, syphilis, or any of those other ones that we named the other day, and when your sexual encounter was with that person, is going to change when you should go get tested, because certain things take a certain amount of time before they show up in your body, or before they'll show up as positive on a test. Okay, and that's what they call like testing windows. So if you've ever been in a medical office and they're talking about testing windows, that's what they're talking about, the rate of, or the date of when the potential infection was passed versus when the test was administered, and what kind of test it was administered, because there's different kinds of tests as well. So if you are engaging in a lifestyle where you are having lots of casual hookups, maybe you're not always using condoms or barriers or other safer sex methods, you should probably, it's a good idea for you to go once every 3 months or so. The maximum I'd say is once every 3 months, because things are not going to show up before then. 3 months is a good amount of time. If you are in a long-term relationship and you've been with the same person for a long time and you guys are monogamous and everything's fine, you know, you probably don't have to get tested super frequently. There are other ways you can contract certain things. So depending on what kind of lifestyle you're leading, you might want to get tested maybe once a year, once every 6 months, depending on what kind of behaviors you're engaging in. Or if there's a concern that you might have been exposed through some other way, things like, syphilis and HIV, for example, can be passed. Like if you have a cut on your hand and it comes in contact with someone's blood who's also infected, things like that. I mean, it's kind of a long shot that you might pick something up that way, but it is possibility for you to pick up something that way. Speaking of this as well, a lot of people, there's a lot of misconception that you can get an STI from a toilet seat. That is, while technically possible, extremely unlikely. Most STIs don't live outside the body very long. They tend to die. So if basically in order to get something off a toilet seat, you would have to have cuts or open sores on your bottom, and then sit on a toilet seat that is like wet with like blood or urine or something like that, and have that like mush into your cuts or open sores. And even then the rate of transmission isn't super high. So I'm not saying it's not possible, but it's extremely unlikely. STIs they don't live on like surfaces like a toilet seat, especially things that are dry. Like that's just not how it works. So back to testing. So as I mentioned, there's testing windows that are meant for different types of STIs. It's also important to note, you may have remembered on Monday when I was talking about STIs, is that not all STIs can be tested for. Like we don't test for herpes because so many people have the HSV virus, either 1 or 2 in their body, and they can have it in different parts of their body, not on their genitals. But if we were to test for that, they would just test positive. But that doesn't necessarily mean they have genital herpes. So there's certain things we don't really have good ways of testing for. So what you can get tested for is, there's different tests for different types of STIs. So, things that it could be a blood sample, it could be a urine sample, it could be a cheek swab, or a swab around the genitals, or it could be a physical exam. So there's lots of different ways that people can get tested for different STIs. Now, you might have heard some people be like, oh yeah, I'm going to go in for a full panel. We're just going to go for a full panel STI test. And usually that means like the works, like you're going to do the cheek swab, you're going to give a urine sample, you're going to give some blood. That's not often that people will do full panels like that. Typically, when you go into a clinic, you're going to chat with the doctor. They're going to ask you some questions like, what is your current life circumstance? Why are you concerned about what you might have contracted? What elements of risk have you been exposed to that this is a concern? What things are you most concerned about? And based on how you answer those questions, that's how they're going to determine what kinds of tests they should do. Now, it's also important to know that we can test for some of the STIs we can test for multiple ways. HIV is usually like a blood test, but chlamydia and gonorrhea, it could be a cheek swab, it could be a urine sample, it also could be a blood test. So there's different types of tests for different types of things, and it's really important you have an honest and frank discussion with your healthcare professional about what you're concerned with, and let them choose what they feel is going to be the best test for you. So what happens when you go in for a test? It can be kind of scary. Lots of people are nervous about being tested. There's no reason to be nervous. Most people are nervous because of the stigma around STIs, which we're going to talk about in a little bit. Before I move on, does anybody have any questions or thoughts about what I mentioned about the different types of tests that you can get, or anything regarding that at this point? I know I tend to talk really, really fast and not give you guys a chance to ask your questions, so I'm trying to work on slowing down. I just get so excited. I'm like, yay, everybody should love talking about this as much as I do. Anyway, but if anybody has any questions, feel free to pop them in the chat or call in and we can discuss any questions. Or maybe you're like, hey, I had this experience and I want to share it because it would be valuable for people. Cool, call in and share it. It'd be a good experience for everybody to learn. That's why we're here. We're here to learn about sexual health and have fun doing it because it's awesome. So far nothing, so I'm just going to slowly continue on. So when you go to get tested, As I mentioned, you're going to make an appointment at somewhere where you can get tested. We'll talk about that in a couple of minutes. But you'll go in, you'll chat with a healthcare professional. They're going to ask you those sort of questions that I mentioned, and then they're going to administer the test. Like I said, it could be any of those things that I mentioned. Honestly, most of the time, depending on how backlogged the labs are, it can take anywhere from like a week to 2 weeks usually, depending on where you live. I know it's like 1 to 2 weeks in the Lower Mainland where I live, but other places it might be longer, or it could be shorter, depending. And usually what happens is that if you test negative, they usually don't call you. Typically, they'll call you if you're testing positive, or if there's something wrong with a sample, or they need to test again, which totally happens. We'll talk about that in a minute, so don't freak out if they're calling you. But typically, if you test negative, they're not going to notify you. It's just, you just won't hear anything back. If you want to know your results and you want to, you can call and follow up. Depending on where you live and the confidentiality procedures where you live, they may not release that information over the phone regardless of what it is. So if you call in, they might just ask you to make an appointment and come in to get your results. That's totally normal, happens all the time. They can't just release confidential medical information over the phone. So if you really are anxious and you're like, no, I need to know, I need to hear the doctor say that I'm negative, just make an appointment and go in. So you can get tested in a number of different places. My first recommendation is sexual health clinics. I recommend this highly because if you're nervous or anxious about getting tested, a sexual health clinic is the best place to go. Because the doctors and nurses there are familiar with sexual health, for starters. They're going to be more used to people who are feeling anxious and concerned about it, because most people tend to feel that way when they go in. So they're a little bit more skilled in making it a little bit more comfortable for you. If you just go to, like if you don't have a family doctor and you're just used to going to like the hospital or walk-in clinic or something like that, walk-in clinic doctors are wonderful, but they're not always the most up-to-date on sexual health. That's not their specialty. So they may not know as much when it comes to sexual health. I also in the past, have gone into a walk-in clinic to get tested and spent a half an hour arguing with the doctor about why. Because I was like, this is my routine thing. Like, this is what I do. I go get tested once a year. That's my thing. I always do that. And the doctor's like, you don't need to get tested. And I was like, yeah, I do. I don't think you're the one to decide that. I think I'm the one to decide that. Thank you. So we had quite the argument about it. And if you aren't willing to advocate for yourself, that might be a big barrier. So if you're nervous about going, check out what local sexual health clinics are near you. I know for BC, there's a great page that you can check. I was just going to comment here, saying most of the walk-in doctors don't even bother testing the throat for STIs. That is also true. They're not likely to do that. And as we learned on Monday, there's a whole bunch of STIs that can, cause issues in your mouth, and some of them lead to throat cancer. So yeah, swabbing the throat, kind of important. But yeah, so I would always recommend checking out the sexual health clinics. As I was saying, BC, there's a website that you can go to. It's Options BC, that lists all the sexual health clinics by, there's a map, so you can locate your area. If you're in the US, Planned Parenthood, they do a bunch of that, and that's really great. I know some people have problems with Planned Parenthood, but that's a discussion for a different day. So check out for your area. I obviously don't know everything for every area of the world, but if you just Google sexual health clinics, plus your hometown, you're going to find one most likely, or you're going to find some recommendations at the very least. You can also go check out your family doctor if you have a good relationship with your family doctor. Most of them are pretty understanding, especially when you have that relationship with them. And then, if you just want to go to a walk-in clinic, go check out a walk-in clinic. There's nothing wrong with that as well. Hopefully you get a good doctor who doesn't fight with you. Also for BC, we actually have somebody else saying hello, disappear. Disappear. Anyway, hi, thanks for commenting. I love it when you guys comment. It's great. I'm not going to type to comment because I'm talking, but acknowledging. Anyway, for BC, there is a fantastic website called getcheckedonline.com. And this is basically, they use this website to track levels of STI. They don't care about they're not going to steal your information. It's purely for statistical purposes. But what you can do is you can go on, you create an account just with an email. They don't care what your email is. It's literally just for you, so you can log in to get your results later. But you create an account. It'll give you a form where you can just type, they'll answer a bunch of questions, basically like you would at a clinic. And what that'll do is at the end, that'll spit out a PDF that you take to a participating life labs. Quick question, slow mode is on? Slow mode. I'm not sure what you mean by slow mode. There is a bit of a delay between me talking and it getting pushed out. That's just the nature of broadcasting. I'm not sure what you mean by slow mode. Anyway, okay, good. The stream is working well for other people, so maybe check your settings on your web browser. Anyway, so Get Checked Online will give you a PDF that you take up to a participating life labs, and they will run the tests for you. And then in a week to 2 weeks, you log in with that account that you created, and it will show you your test results. Now, this is really great if you're just wanting to do some routine testing where you're like, I'm not really concerned, but I like to go get tested once every 3 months, 6 months, year, whatever it is. And you just go and do it, and it's a nice stress-free way to do it. The only downside of this is that if you do test positive for something, you're going to have to go to a clinic and probably get retested, because the clinic will have to verify that you do have it before they give you medication for it. Unfortunately, most of the time they don't just accept those results. They have to do the test again. So just something to know, because you definitely want to get treatment if you tested positive, but you'll probably have to go through that testing process once more. Slow mode says I can only send messages about once a minute. Oh, well, thank you for letting me know. I don't know if I can change that right now. I'm sorry, I'm not going to play around with the settings while I'm broadcasting, but I will I will look into that afterwards. Thank you so much for letting me know. I'm newer to Twitch, so still learning the ropes when it comes to Twitch. Okay, so does anybody have any questions about anything I've said about testing so far? I'm just going to pop the website into the chat. So that's the website for BC, getcheckedonline.com, if anybody wants to check it out. Anybody have any questions or comments or thoughts about anything I've said so far? Or I'm just going to give you guys a minute to think about that, and also to call in with your comments, because like I said, I tend to talk really, really fast, and people say. So I do have a comment coming in, and hey, just wondering, sorry if this doesn't have anything to do with this, but I know someone who gets headaches that corresponds with menstrual cycle. Any ideas? And the options BC lists. Oh yeah, I will grab that as well for you guys. So the migraines with the menstrual cycle is, yes, that is a common symptom for some people. One second. There's the options website. Sorry, I didn't go into the specific part about sexual health clinics, but it's on there. Anyway, so for the migraines or headaches, that can be caused by a lot of different things. Sometimes it's dehydration. It's really common for people. You're welcome. Really common for people or yeah, so it's really common for people with uteruses around the menstrual cycle to become dehydrated. So a good thing you can do to relieve the pain is make sure that lots of hydration. Headaches can also be caused by lower iron, because what's happening during the menstrual cycle is the uterine lining is being shed. which can result in obviously blood loss and less iron. So iron supplements, making sure they're getting lots of water, and then unfortunately just some ibuprofen. Another good thing for headaches is if you have like a cold pack, putting it on the back of the neck can help, or sometimes around the temples. It varies a little bit from person to person. Sometimes people say caffeine helps with their headaches as well. So it's a little hit and miss and kind of dependent on the person. I hope that helps. All right. And it's totally fine that you ask something not related to testing. You guys can feel free to call in or comment your questions at any point. That's sort of the reason that we're here, is to help people get answers, right? I like doing the topics because it definitely helps sort of move things along when people are not calling in. Definitely not dehydration. She drinks lots of water, has good iron, eats lots of iron fortified cereal. Well, that's good. So she can check in with a doctor as well. There might be some other compounding issues. Unfortunately, headaches do tend to be part of PMS typically for some women. So she might just have to do the cold packs and ibuprofen. Unfortunately, I don't have any other amazing suggestions. I also suffer from migraines and headaches as well, so I completely sympathize, and I am also equally frustrated by the lack of answers in the medical profession as to why that happens, but there isn't really a lot there. So anyway, so any other questions or thoughts, comments? If anybody else has any migraine advice, feel free to call it in. Great. I'm glad you guys are enjoying it. And yeah, definitely try the cold pack. All right. Aside from that, we will keep soldiering on. So, the other big piece about getting tested is having that discussion. Having that discussion about STIs and testing positive and negative. Now, a lot of people talk about, a lot of people use terminology like clean and dirty. People don't usually necessarily say dirty as much, but they say, oh, I'm clean, when they actually mean I'm negative. I didn't test positive for anything. And as much as possible, I like to encourage people not to use that terminology, because the implication is that people who do test positive are dirty. And that's incredibly stigmatizing and shameful. And people have a lot of shame and upset around STIs. A lot of it's caused by misinformation or lack of information, but a lot of it's caused too by that terminology and how we approach the conversation. So it's important to know, people who do test positive, it's not you're human, it's an infection. Okay? We don't freak out when somebody has okay, I shouldn't say nobody freaks out. Most people don't freak out if you get a cold or the flu or, like a staph infection. It happens. That is why we have modern medicine. It's nothing to be ashamed about. What's shameful is not doing anything about it and allowing those things to damage your body, right? That's the part that's not okay. And unfortunately, when people get sort of trapped in that shame, they will avoid going to get tested. Some people actually even avoid treatment because they're too ashamed to admit that they need help or that there's a problem. Some people especially won't go to the doctor if they do have a problem, right? So it's really important what type of language that we use when we're talking about testing positive and negative, and trying to stay away from that clean, dirty terminology. So, if you've tested negative and you want to have that discussion with your partner, which is a good idea, try and keep it straightforward, keep it to the facts. You can be like, hey, I was recently tested for whatever you were tested for, and I just wanted to let you know that I tested negative. How about you? What have you been tested for recently? What were the results? You just have to keep it calm, cool, matter of fact. It doesn't have to be a big, scary, heavy conversation. And yes, thank you. There is an anonymous notification service for STIs. I was going to get to that too. But thank you for bringing it up. So yeah, so if you want to have that conversation, try and keep it nice and light. If you are not comfortable, that's okay. I love it when people share knowledge. It is wonderful. Do not be sorry. You know stuff, and that's amazing. You're amazing for knowing things, and you're amazing for sharing it, so do not be sorry. Anyway, so if you are anxious about sharing test results, whether they're positive or negative, typically more people are more anxious about sharing positive results. There is it's definitely in BC. I can't speak to other areas of Canada or the United States, but in BC, I know for a fact that there is a anonymous notification service. And what happens is that if you test positive, when you get the results, they will ask you if you would like them to notify sexual partners. And all you need to do is actually just list the partners that you've had and their contact information. And the service or the clinic won't actually, I mean, they're not going to call the person up and be like, oh my God, so-and-so just came in and they tested positive and they delisted you, you know. All they do is call and say that they've received some information that someone that you might have been intimate with recently has tested positive or something to that effect. And they ask the person to go in to get tested just to be safe. So there's no names, it's very, very chill, very calm. And it can be a great way for people who are really anxious. Maybe it was a bad situation that ended or something to that effect, but you had contact with them recently and there's potential, you know, it's important that people are notified because people need to know for their health, right? And it's about stopping the spread of disease and infections. So we want to protect other people as much as ourselves, right? And that's why it's important to tell people. So, if you do test positive, obviously follow a healthcare professional's advice. I try not to stress about it. I mentioned that when you get tested, they usually don't call you unless they want you to come in. Now, if they do call you, don't immediately freak out. They might be calling you because the sample, sometimes people don't give enough of a sample, or maybe the sample wasn't enough to test whatever they were testing for, or any number of reasons. They might also be calling you for some other unrelated reason, like, oh, hey, we took a blood sample and we noticed that this was weird or something. If you do test positive, like I said, not the end of the world as well. It's an infection. Good news, most of them we can cure. Yay! The important thing is to go in and get that information. As for disclosing, I sort of jumped the gun a little bit talking about that because I was going to say it is important to disclose. I sort of covered that based on, you know, protecting people's health. But how you choose to disclose is like it's important that you do what's right for you. There are some people who insist that you should disclose in person. You should always tell somebody in person. And yeah, if you feel comfortable and safe to do that, I think it's probably better and a better show of faith to someone that you've been intimate with that you tell them in person. However, it is not always possible. It is not always safe, and it is not always a good idea. So I think that you should do what's right for you and what's right for the situation. And that means, you know, if you call them, if you text them, if you use like the anonymous service we were just talking about, you should do what is going to be best for you and what is consistent with your personal ethics and, you know, is going to be the safest for you. If you do decide to tell somebody in person, then just try and keep it calm, you know, stay confident and just keep it matter of fact. The more you can deliver this way, the more it's going to be accepted this way. You know, people have a tendency to naturally react to our energy and how we present things. So if somebody is really nervous or anxious and upset and like is like, oh my God, this is the end of the world, I tested positive for, the person that they're telling is going to be like, oh my God, this is a big deal, holy crap. Because a lot of people don't know, right? They're misinformed, or they have misconceptions about STIs, or they never got the education, or they, you know, there's all these reasons why people can react that way. And when you react that way, it kind of like you feed into each other's energy, right? So the more you can stay calm and confident and just matter of fact, you know, hey, I recently went and got tested for chlamydia. I tested positive, you know, it might be a good idea if you go in just to be safe, right? It makes a big difference, the delivery, right? And it's also going to change somebody's anxiety level. Now, you can only control so much. People are going to react the way they're going to react, right? But they're going to react better. Like if somebody tends to be a high reacting person and you start high, they're just going to go higher. If you start lower, they're going to go lower, right? They're still going to have a reaction. They're going to react the way they're going to react, but you can have some sort of impact on how intense it is and how intense it feels for you. The other important thing to know is that you don't have to disclose the full details. Okay, you're under no obligation to say everything that you know, to give a full list of all your activities. Say as much as you feel comfortable with. At the end of the day, it's your sexual history, right? You still have a choice about what you disclose. The main part is that you've done your due diligence. You've let them know that maybe they should go get tested just to be safe. And that's all you really have to tell them, okay? How much you tell them it depends on you, and it depends on what you're comfortable with and what the relationship is and so on and so forth. So don't feel pressured, or don't let people pressure you to press you for information. You know, maintain the boundaries that you're comfortable with, okay? If somebody does react really badly, you know, just give them some space. Like I said, a lot of people have those misconceptions about STIs. Either they don't know, or they think they have wrong information, whatever, or maybe they have some sort of history with a specific situation that has made it feel more intense for them. So if somebody has a bad reaction, just give them some space, give them some time to calm down. You can't control their reactions, so, you know, just give them some space. The other thing too is, remember, try not to take it personally. Whatever reaction they have, whether it's good or bad, just remember it's not about you. It's about their experience, their knowledge, their past, right? In that moment, you're simply a catalyst for their reaction. It is not about you. How they respond to you is not about you. They're responding to their prejudice of sexual health or whatever. You know, so it's not about you. And if somebody has a bad reaction, remember, it's not everyone's going to react that way. Lots of people are well informed. Lots of people have a good understanding of, you know, what treatment options are, what life is really like, you know, even if for things we can't treat with HIV or herpes, what life is really like for somebody living with HIV or herpes. And we're going to talk about that on Friday. But, you know, it's important to know that not everyone's going to react the same. So if somebody has a bad reaction, do not let that color don't say to yourself, oh my God, I can't tell anybody else because everyone is going to react this way. It's not true. Everybody's going to respond differently based on their own stuff. Okay. Does anybody have any thoughts or questions, comments, concerns, ideas? I sort of wanted to chat a little bit now about reducing stigma around STIs. And a good way we can do this is by talking about it, you know, educating people about it. You know, share this podcast. Share the one I did on Monday about STIs and the one yesterday about condoms and barriers. The more people know, the less scary it is. Like I've said earlier this week, a lot of people are really afraid of STIs because traditional abstinence-based sex ed programs have used them as, this is scary, oh my God, you will die, your life will be over if you have sex because of these things, it's so scary. So lots of people still have that reaction, oh my God, it's so scary, I know nothing about it, but it is scary, that is what I know. So reducing stigma is really about having those conversations, being chill about it, being calm about it, knowing the facts, okay? Knowing what's out there, knowing what you can do about it. So I highly encourage, and in fact, I challenge everybody on this call and everybody listening to this after the fact, you know, talk to somebody in your life, you know, talk to a friend, talk to your partner, talk to, I don't know, whoever, talk to a stranger on a bus. Okay, maybe don't do that, unless they seem super chill, because you might weird them out, might be awkward. But, you know, talk to somebody about what you learned this week. You know, make it a challenge. If you didn't catch my talk on Monday, go listen to it. If you don't want to listen to the whole hour, pick one STI and learn something about it, you know, and then tell somebody else, right? I actually posted this question on Instagram recently. What do you do in your life to reduce STI stigma? And somebody commented that they actually, when they go get tested, they have like a testing party and they invite all their friends to go get tested, you know? And I thought that was great because you can be supportive of each other. You can make it a fun experience. You'd be like, hey, everybody, let's go get tested. Now let's go get our nails done, or let's go see a movie, or let's go get drunk, or let's go do something fun after this, and make it an experience. Take the fear out of it. Some people don't want to go by themselves. That's another reason a lot of people don't get tested too, is they're afraid. They're afraid to go by themselves. They're afraid to know. So it can be a lot less scary if you go with a friend. One thing I forgot to mention earlier when I was talking about why it's important to know what your status is, and speaking of going with friends and stuff like that, but it's important to know your status too, because when you know, or what you don't know, can actually have some implications, not just for yourself, but for other people too. And as far as a legal standpoint, not so much in Canada actually, but in the US, knowing and not knowing can actually make a legal difference. So, unfortunately, I think that's actually something that keeps a lot of people from being tested in the States. The healthcare system, unfortunately, is not as good as in Canada. And so there isn't always the same options for treatment that are as easily accessible. So people who, in the States, if you know that you have an STI and you fail to disclose it, you can be legally liable if somebody you have intimate contact with tests positive. I don't think that's true. I'm not 100% sure if that's true in all of the states, but I know it's true in quite a few of them, which is unfortunate, like I said, because I think it keeps a lot of people from getting tested, and lots of people in the States need to be tested because according to their sexual health data, they have a lot of rates of STIs, and those are just the tested ones that they know about. So God only knows the widespread population. Not to say Canada is amazing either. We have some pretty high rates here too, but at least testing is free and treatments are often inexpensive and mostly covered by medical. So does anybody have any things that they do to reduce STI stigma? Do you guys have any suggestions? If you want to call in or type them out in the chat. No suggestions on how you reduce STI stigma? We got talking about it. We got inviting your friends to go get tested. I once went to a play party, a BDSM play party a few years ago. And one of my favorite things about that particular party is they actually had a nurse practitioner there who was offering testing. And I was like, this is amazing. This is so great. I would love it if more play parties do that. I realize that that's not always possible, and I imagine that that was probably a pain in the butt to set up and coordinate, but amazing. Yeah, great place, great thing to have at, any sort of like sex parties or BDSM parties or bathhouses. Yeah. I think that's great. I love it when they make it super accessible like that. Yeah, I guess that was sort of all I wanted to say. I was hoping you guys would have some other things that you do to reduce STI stigma. But I won't force you. It's all about the consent. If you want to chime in, that's cool. Okay, well, I guess we'll slowly move into final thoughts in case anybody has anything else they want to pop in. I really appreciate how much everybody has chatted today. I love it when you guys comment. It makes me feel like I'm not talking to myself, which when you guys don't comment, I kind of feel like I am because I just see myself on the camera and that's it. That's actually why I'm like, please call in so I can hear someone else's voice aside from my own. Anyway, so we're continuing on tomorrow with our conversation about sexual health. The topic for tomorrow is fluid bonding, which is a kind of a cool concept, another safer sex method. So we'll talk all about that, why it's great, what people hate about it, you know, how do you successfully fluid bond, what does that even mean? We're going to cover all that really good stuff tomorrow. I have lots and lots and lots of resources on my website, exploresextalk.com. So please go check it out. There's lots of free articles and games on there. You know, if you want to test your sexual health knowledge, I've got like word searches and crosswords and memory games and, you know, all sorts of crazy stuff on there. There's also lots of really good informational articles. Also, for people who are looking for, you know, that little bit extra, please check out my Sexy Hero Society. It's a membership portal. It's $20 a month and gives you access to lots and lots and lots of extra awesome content. There's relationship challenges and research reviews and erotica slams and, you know, coloring pages and sex positions and so much stuff. I can't even talk about it all. Sex tips. I don't know. There's so much stuff on there and it's amazing. And it's only $20 a month. And your $20 goes to support furthering sex ed. So how could you possibly spend it better? Anyway, I hope you guys really enjoyed today's show and learned something. And I have one other ask. If you can please share. Oh, I see there's a comment. Oh no, the Sexy Hero got you a 404. Oh no. Why is that happening? Okay, I'll have to, sorry about that. I'll double check. Sometimes my plugins need to be updated and they don't. Oh, it's loading for me. I don't know. It's loading for me. I'll have to look into that. I'm not sure why it's not loading for you. Also, I just saw and I'm just going to go back to the comment thing because that makes it easier for me to see comments. Oh, there we go. Okay, so random question from last night's episode. Any recommendations for custom size condoms for purchase in BC or Canada? If you want to go, if you're looking for something in person, I would actually go to like the sex stores, Fantasy Factory, or I would also highly, actually my first recommendation would, oh, of course I'm blanking on Little Sisters. I was like, why can't I think of the store's name? I love this store. I would check out Little Sisters. They've got a good selection. Also, I would also check out the Magnum brand. Magnum has quite a few different sizes, and they range quite a lot. What's carried in store is not always what they have in full selection. So if you're checking out drugstores for Magnums and you're like, oh, I'm only seeing like 2 sizes, I think they actually have like, I don't know, I think it's 4 or 5 different sizes. Go check out their website and you might have to order them online. But definitely Magnum is a good brand for extra large, jumbo, you know. So yeah, so those can be good ones. Any other questions? You're welcome. Yay, condoms. Yeah, I like Magnums. I think they're great. They're a good brand. All right. Cool. Well, I think that pretty much wraps it up. We're running out of time for today. So I will see you all tomorrow at 8 p.m. Same bat time, same bat channel. And yeah, if you guys can please share this. I'm still getting the word out that I'm doing these. So sharing is caring. Share it out. Help people learn stuff. Take that challenge to learn something about STIs and safer sex and share it with somebody. And you guys have a great night. We'll see you tomorrow.